stories tonight on Y News. The Philippines and the National Capital Region are again considered as high risk to COVID-19 due to rising cases.
All Metro Manila mayors have agreed in principle that unvaccinated individuals must remain in their homes except for essential trips during Alert Level 3.
The Departments of the Interior and Local Government ordered the Philippine National Police to conduct random visits in quarantine hotels in the wake of reports that some hotels offer absentee quarantine arrangements to Filipinos returning to the country.
Food and Drug Administration Director General Eric Domingo announces his resignation from his post effective today, January 3.
Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Monday, January 3, 2022. I am Harleen Delgado. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Tino.
First in the news, Metro Manila mayors agree to limit the mobility of individuals still unvaccinated against COVID-19. Asher Kadapan Jr. tells us why.
Persons unvaccinated against COVID-19 are more vulnerable to the disease and should be protected amid the threat of Omicron variant. Metropolitan Manila Development Authority Chairman Benhar Abalos Jr. explains this as local chief executives in the National Capital Region agree to limit their mobility while Alert Level 3 is in place.
Karamihan po ng naapektuhan talaga at napupuruhan ay yung mga walang bakuna. Natin at napakita ko sa inyo kanina, talagang dumadami ang kaso. Pero awa ng Diyos, masiya paano, yung severity at vitality so far ay hindi po ganon. No? Pero yung mga walang bakuna ay talagang sabihin na natin na talagang delikado sa kanila.
Under the resolution agreed by the NCR mayors, unvaccinated persons as well as minors and vulnerable sectors, including senior citizens and persons with comorbidity, will not be allowed outside their residence. But they will be allowed if they are procuring essential goods and services, individual exercise within their barangay or village, and for work purposes.
Para kang like ECQ only for the unvaccinated. No, for their own protection. Dapat nasa bahay lang sila, pwede sila lumabas kung bibili na sila ng essential goods and services, no? Not limited to food, water and medicine, medical devices, public utilities, energy and work, and medical and dental necessities. Ngunit, inuulit ko, pwede sila mag-exercise within their own.
On-site employees are obliged to undergo reverse transcription polymerase chain reaction at their own expense every 2 weeks. Antigen tests may be done instead in the absence of RT-PCR tests. Persons entering the allowed establishments, on the other hand, should present their vaccination card and an identification card where random verification with the local government units may be done. Meanwhile, the Department of Trade and Industry as well as the private sectors support such measure of the Metro Manila Council.
We definitely support yung move na yan. Ilimit na muna yung mga unvaccinated for their own safety. We'd like to thank sila MMDA Chairman Abalos at ang mga mayors at ilimit natin sa essential activities muna ang galaw ng mga unvaccinated at bigyan natin ng privilege na lang yung vaccinated. Again, para maiwasan yung unvaccinated, sila pong tatamaan nitong Omicron.
The Interagency Task Force for the Management of Emerging Infectious Diseases, however, will discuss if the guidelines need to be revised as more people are now vaccinated compared to the time when the resolution was created. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the government is now taking steps in ramping up its detection, isolation, and treatment efforts. Irene Cerudo will tell us why.
As Aside from the Omicron COVID-19 variant, the national government is ramping up its efforts in line with the surge of cases in Metro Manila. Presidential Advisor for COVID-19 Response Secretary Vince Dizon said the government will boost its prevention, detection, isolation, treatment, and reintegrate or PDITR strategy to streamline the process of testing and treating individuals positive of COVID-19 or are possible carriers of the Omicron variant.
Doon po sa ating detection, isolation, treatment. Lahat po yan ay automatic na paiigtingin pagka tumataas ang kaso at pag tumataas ang alert level.
In preparation for its ramping up efforts, the government will renew contracts of former contact tracers as well as the procurement of additional supply of testing kits for laboratories. Hospitals are also in full alert where new health workers will be hired for additional manpower. Quarantine facilities are fully prepared to accommodate COVID-19 patients.
Kailangan nating matandaan din na dinaanan na natin ito, pang-apat na na-surge ito simula noong 2020. Dinaanan natin nung nakaraang ilang buwan lang yung Delta surge na napakahirap, lalong-lalo na nasa kalagitnaan pa lang tayo ng ating pagbabakuna. Pero lahat tayo alam natin na ang paraan lang para mapigilan natin to at magawa natin yung nagawa na natin nung nakaraan at napababa natin ang mga kaso, lalo na yung Delta na napababa natin ng mabilis, kung tayong lahat ay magtutulungan at simple lang po, lahat tayo ay dapat magpabakuna.
Amid the discussions of allowing self-testing kits, Secretary Dizon said there are a lot of things to consider before an individual can use COVID-19 testing kits.
Yung pong pagbibigay ng personal na responsibilidad sa ating mga kababayan, tingin ko sa halos 2 taon na nating pinagdadaanan, tingin ko importante din po na i-consider natin ang maigi yan, no, kagaya ng ginagawa nila sa ibang bansa. Pero pinag-aaralan po yan ng ating mga eksperto ngayon.
Meanwhile, the government appealed to the public to get vaccinated, especially when they are more prone to get infected with a severe case of COVID-19. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippine National Police will strictly implement local ordinances under the Alert Level 3 in Metro Manila. Leia Ilagan reports.
Police commanders in Metro Manila were ordered to coordinate with their respective local government units or LGUs for the implementation of a stricter health protocols in the National Capital Region. The PNP's procedure is to reprimand minors who are loitering outside during curfew hours. Maximum tolerance will be upheld. NCRPO Director, Police Major General Vicente Danao Jr. also said they will not implement border checkpoint inside and outside Metro Manila under Alert Level 3.
Yung Alert Level 3 kasi, wala pang checkpoint yan eh. Pero that will be depend purely on the areas concerned. For example, sa isang barangay, sa isang post yan na talagang kailangan subject for granular lockdown.
But Danao adds they will strictly implement health protocols, especially in the places of convergence.
Ang mga mataong lugar lang naman, yung Divisoria, Baclaran, doon lang naman na medyo may mga katigasan na ulo. Sa malls naman kasi controlled naman yung dahil may sariling guardia yan eh. I-remind lang naman sila.
The PNP expects fewer people going outdoors but still appeals to establishments and LGUs to assist by deploying force multipliers if the need arises. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
The Health Department reports that the country is again at high risk for COVID-19. The National Capital Region, or NCR, is also at high risk classification for COVID-19 again. Aiko Miguel reports why.
Nationally, we are now at high-risk case classification from low-risk case class in the previous week, showing a positive 2-week growth rate at 222% and a moderate risk average daily attack rate at 1.07 cases for every 100,000 individuals. Cases in the recent 1 week also shows a positive increase. The National Health System's capacity is at low risk with total bed utilization at 18% and ICU utilization at 22%. The National Capital Region is at high-risk case classification, showing a high-risk 1-week growth rate and 2-week growth rate, and moderate risk average daily attack rate of 5.42 cases per 100,000 population.
From 307 daily average cases last December 20 to 26, COVID-19 cases are now averaging at 2,067 daily since December 27. According to the DOH, this is 7 times or 570% higher compared to the previous weeks. Even the epicenter, the National Capital Region, is now at higher risk classification. The DOH explained there are multi-factors which affect the rise of COVID-19 cases. This includes the mobility, gatherings during the holiday season, and the high possibility of local transmission of Omicron variant of concern in the Philippines. Although the country is placed under stricter alert level 3, reimposition of use of face shield is not yet considered.
Kapag alert level 1 to 3, hindi na po natin kailangan magsuot ng face shield. It's already voluntary, no? Alert level 4, pwede pong mag-require ang establishments or local governments ng imposition ng face shield. But alert level 5, ito po ay magiging mandatory for everybody that face shields should be used already. Pero syempre, pag-uusapan pa rin po lahat yan based pa rin sa recommendations ng ating experts at sa approval din at pag-uusap sa IATF.
Meanwhile, the DOH assures all close contacts of the 3 local Omicron cases were traced and have recovered.
But just to ensure to everybody, all local cases were all located and traced and completed their minimum 10-day isolation period and had been tagged as recovered prior to the release of the genome results.
The close contacts of the first 3 Omicron cases in the country have already tested negative for COVID-19. Patient 4 has 24 close contacts, 3 tested positive for COVID-19, 15 tested negative, and 6 are still being verified. Details on the contact tracing of the other infected patients are still being verified. Experts also advise the public to immediately isolate once they feel any mild symptoms, as Omicron variant has no proven unique symptoms compared to flu.
1/3 yung hospitalizations from Omicron compared to Delta across all groups, whether vaccinated or unvaccinated. Siyempre, mas mababa yung sa bakunado. Tapos Omicron, wala masyadong nawawalan ng panlasa or pangamoy. But it's very difficult. Hindi pa conclusive yun. But we also know that Omicron, about 40% of them will be asymptomatic. So kaya mahirap rin maprotektahan ng sarili kasi maraming ang umiikot na wala namang sintomas at nakakahawa ng Omicron.
Ako, doktor ako, no? So, walang exact, no? Na listahan ng sintomas kung ito ay flu, kung ito ay COVID-19. Dito sa flu naman, masakit ang kasakasuan na makikita rin natin sa COVID-19. Naglalagnat paminsan, makikita rin sa COVID-19. Nagsisipon, makikita rin sa COVID-19. Huwag po tayong magdadalawang isip na baka flu lang ito, baka trangkaso. Immediately isolate yourself and have yourself tested.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health has advised the public to use telemedicine services to avoid congestion in emergency rooms. This comes after several hospitals in Metro Manila noted an increase in COVID-19 admissions after the holidays. DOH spokesperson Undersecretary Maria Rosario Vergara says there is an increase in COVID-19 infections, but mostly for mild to moderate cases.
So lahat po ng mga ospital ngayon, may close coordination po sa Department of Health so that we can monitor them closely. Kaya po kami ay nagpapaalala sa lahat po ng ating kababayan, huwag po tayong agad-agad pumunta sa mga ER ng ospital. Meron po tayong mga telemedicine services, meron po tayong hotlines ng ating local government health facilities para ito na lang muna po ang ating gamitin para hindi tayo mag-congest sa ating mga ospital.
The National Kidney and Transplant Institute, or NKTI, in Quezon City has reported an increase in the number of COVID-19 patients and those who are submitting for swab testing.
So dati nagsi-zero kami. May time na ngayon na 6 siyam ang na-admit namin. So napansin na rin namin yung nagpapaswab dito sa atin sa NKTI, pamilya na rin. Even before the new year, ganun na of concern really.
Currently, the hospital has 33 COVID-19 active cases, while 21 of its health workers are also infected. The NKTI has added 2 COVID-19 tents, while a separate modular tent for dialysis patients was placed to ensure the safety of both COVID-19 and non-COVID-19 patients. While still on green alert, the hospital assures the public there is a system in place should there be another COVID-19 surge. The NKTI also reminds the public not to be complacent. Meanwhile, the Manila City government has placed its 6 district hospitals under Code White. In Philippine General Hospital, 116 confirmed and suspected COVID-19 patients are admitted. The emergency room of GAT Andres Bonifacio Medical Center has stopped admitting patients since January 1 due to the rise of COVID-19 infections among the hospital employees. The hospital says all incoming patients shall still be evaluated and transferred to other city hospitals. The Justice Jose Abad Santos General Hospital also stopped its admission for the meantime due to increase in COVID-19 infections among patients and health workers. The management says it has to decongest first and address the rise of COVID-19 cases before it could resume admitting patients. Massive testing and disinfection are now underway. The hospital ng Malabon has been closed from January 2 to 4 for outpatient and non-COVID-19 cases. The hospital announced that it will conduct swabbing and disinfection after 19 of its employees tested positive for COVID-19, while 40 are under close observation. Outpatients and non-COVID cases may proceed to the Super Health Center in Barangay Catmon in Malabon or may coordinate with the Malabon Command Center.
The Department of the Interior and local government ordered the Philippine National Police to conduct random visits in quarantine hotels. Rosalie Cos will tell us why.
Several contacts of the COVID-19 positive returning overseas Filipino who skipped quarantine after returning home from the United States of America have also been infected with coronavirus disease, according to the Department of the Interior and Local Government or DILG. However, it is still unknown what coronavirus variant hit the quarantine violator.
Doon po sa kanyang close contacts na 15, 7 na po ang nagpositibo ng COVID-19, while doon naman po sa 19 secondary contacts niya ay isa na po ang nagpositibo. So talaga pong naging super spreader event yung paglabas-pasok nitong ni poblasyon girl sa kanyang quarantine hotel.
Also, based on the initial investigation of the PNP Criminal Investigation and Detection Group or CIDG, the hotel wherein the Balikbayan is supposed to quarantine is responsible in the quarantine breach. It was on December 22, 11:23 p.m. when the Balikbayan arrived at the airport and just stayed in her quarantine hotel for less than 30 minutes, and at 11:42 p.m. she went home. The person attended a party in Poblacion, Makati instead of undergoing isolation and tested positive for COVID-19 on December 27. On the other hand, Interior Secretary Eduardo Año has already instructed the PNP to conduct random checks in quarantine hotels in the country. This is to address the problem of absentee quarantine. The Department of Tourism as well as the Bureau of Quarantine lack manpower to guard the 150 accredited quarantine hotels in the country, including the 6 to 8 facilities in Metro Manila.
Siya po ay nagbigay din ng direktiba na bisitahin or magkaroon ng random visit sa iba't ibang mga quarantine hotels sa buong bansa ang PNP.
During the random checks, the police will ask for the list of those who should be at a quarantine hotel through the BOQ, and if that person is not there, he or she will be immediately investigated and cases will be filed against that person, and also those who are involved in the quarantine breach. Meanwhile, the DOT has received other reports of quarantine skippers even before the incident with the Poblacion girl. However, the DILG has not received information on this but will investigate on alleged quarantine violators.
but definitely we will investigate para po maging proactive na ang ating pamahalaan. Tutulong na po ang DILG at ang Philippine National Police sa DOT at sa Bureau of Quarantine para po malaman na natin kung may mga nag-i-skip nga or nagkakaroon ng absentee quarantine.
Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Tourism has endorsed to the Philippine National Police the case on the alleged quarantine protocol breach committed by a returning Filipino. Dante Almento tells us why.
The Tourism Department disclosed it has finished with the investigation over an alleged quarantine breach committed by a certain returning Filipino. The DOT added the case was endorsed to the Philippine National Police as member of the one-stop shop for management of returning overseas Filipino. Justice Secretary Minardo Guevara stressed that if the reports are factual, there are also ordinances that constitute penalties not only to the concerned person but those who might cooperated with the violator. Based on investigation, the violator was referred to a hotel in Makati for the mandatory quarantine for returning Filipinos. She was picked up by the hotel staff but apparently evaded going to the hotel but rather claimed she has given quarantine exemption which turned out to be non-existent. The Tourism Department reminds anew all establishments and the traveling public to be responsible and strictly observe the protocols imposed by the authorities. Meanwhile, in a statement, the Berjaya Hotel apologizes over the incident. It has assured to make anyone accountable over commission or omission of what had happened. Their support is allegedly full in the investigation by the government agencies. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, Food and Drug Administration Director General Eric Domingo said he has resigned from his post effective today. In a Viber message, he said he already did his part during the pandemic and leaving the FDA stronger, more efficient, and systems are in place. Dr. Domingo added it's time to move on to other things. It was in May 2019 when he began serving as the officer in charge in the Food and Drug Administration. His resignation came after the dismissal of former FDA head Nela Charade Puno. It was in February 2020 that President Rodrigo Duterte appointed Dr. Domingo as the Director General of the Philippine FDA. In a separate message, the Department of Health confirmed his resignation, and the DOH has assigned FDA Deputy Director General Dr. Oscar Gutierrez as the officer in charge.
An official from the PDP Laban Pacquiao Pimentel Group believes that the petition filed by the Cusi Group in Comelec is just a ploy to derail the 2022 elections. Nel Maribohok will tell us why.
Senatorial aspirant and PDP Laban Vice Chairman Lutgardo Barbo urged the Commission on Elections to junk the petition filed by Cusi Group. He said the petition seeking to reopen the filing of the Certificate of Candidacy is a last-ditch effort of Secretary Cusi and his group to subvert the will of the people and should be ignored by the Comelec. Barbo also said that the petition may result delaying and derailing the electoral process and benefit at a chance to have failed elections to prolong their hold on power. Presidential aspirant Senator Panfilo Lacson, however, said that the Senate is preparing for a possible no-election scenario. Lacson said he would not like to think that the intention of the petition filed by the PDP Laban is to delay the election on May 9 and pave way for the extension of the term of office of the President. On the other hand, the senator suggested to Senate President Vicente Soto III and some of his colleagues that the Senate must not allow this to happen. He said if that scenario becomes imminent before Congress adjourns, they will elect a new Senate President whose term expires on June 30, 2025, and he or she shall act as President until a new President or Vice President shall have been chosen and qualified. This, he said, in accordance with the presidential line of succession as provided under the Constitution. But PDP Laban Cusi Wing defends the petition. They said they are only exercising its rights under the election laws. The party also said that the petition is based on constitutional precept on the exercise of suffrage. And as a consequence, it is also imploring on the Comelec to resolve all issues before the ballots are printed. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
Comelec First Division Presiding Commissioner Maria Rowena Guanzon has disclosed that the preliminary conference proceedings of one of the disqualification cases against presidential aspirant Ferdinand Bongbong Marcos Jr. may be viewed by the public online on Friday, January 7 at 9 a.m. It will also be the first preliminary conference proceedings of pending cases to be live streamed. Guanzon also warned anyone that will disturb or interrupt the proceedings will be cited in contempt. This case was filed by Akbayan Group for the ground of allegedly non-payment of taxes by Marcos, which constitutes perpetual disqualification from holding public office. For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The Commission on Higher Education clarifies that in-person classes on college level and vocational courses in the National Capital Region, which is now under Alert Level 3, will be allowed under IATF guidelines. Janice and Hente will tell us why live. Yes, Janice.
Harleen, after MMDA announced the limited face-to-face classes in Metro Manila was suspended due to the continuous increase of COVID-19 cases, Commission on Higher Education Chairman Prospero de Vera III clarified that in-person learning for college students and technical vocational courses will continue. According to De Vera, based on the IATF guidelines, tertiary level students can take physical classes under Alert Level 3 in 30% capacity and only for those who are fully vaccinated students. MMDA Chair Benner Abalos announced earlier that only students from kinder level to senior high school are not allowed to take physical classes under Alert Level 3.
The following establishments are characterized as high risk for transmission and shall not be allowed to operate or be undertaken in areas under Alert Level 3. Number 1, face-to-face or in-person classes for basic education. Ito na may mga pinapayagan. Limited face-to-face in-person classes for higher education and for technical vocational education training.
Meanwhile, the Department of Education agreed on the decision of Metro Manila mayors to suspend face-to-face classes for safety of young students. But the DepEd clarified that schools under Alert Level 1 and 2 will still continue on its physical classes. According to Metro Manila mayors, the suspension of face-to-face classes in NCR will last until January 15 or depending on the development of the COVID-19 situation in Metro Manila in the next weeks. Harleen, DepEd officials are now discussing whether there will be an adjustment to the limited face-to-face classes expansion plan, which will begin this January. Back to you, Harleen.
Thank you, Janice and Hente, reporting live from Quezon City.
Local government units in Metro Manila are now conducting a pre-registration through online portals for pediatric vaccination. JP Nunez explains why.
As local governments in Metro Manila awaits the final guidelines from the National Vaccination Operations Center for vaccinating 5 to 11-year-old kids, pre-registration are now open through links or QR codes which are posted on the official Facebook pages of respective LGUs. This to provide a list before the vaccination rollout. In San Juan City, there are more than 1,000 kids already registered through their online portal which they opened yesterday.
Kaya naman tayo nagpo-pre-register para kapag sabihin nila, o bukas simula na ang 5 to 11 years old, meron na tayong datos. Meron na agad-agad tayong mga 2,000 o 3,000 kabataan na mababakunahan.
San Juan City estimates 6,000 kids of the said age bracket are expected to receive their first dose of COVID-19 vaccines. Manila, Taguig, and Pateros also posted links and QR codes through their Facebook pages for the pre-registration as early as December. Meanwhile, Malabon City has not yet opened their online portal since they were focusing to vaccinate remaining population for primary series and those who will receive booster dose. But they will announce the official process before the actual rollout through their social media sites and public announcements.
Piniprepare pa namin yung yung online registration.
Ayun na.
Para hindi magulo kasi kita mo ngayon medyo busy tayo ngayon sa vaccination para dun sa yung mga hindi pa nabavaccinate, hindi pa nababakunahan at saka yung sa booster. Yung bata, nag-prepare na kami. Gumagawa na kami ng online registration.
Metro Manila Council strongly believes that even children need to get vaccinated to protect them against COVID-19 variants.
And that is what we need at this point. We are really experiencing an increase in the number of cases. No? Huwag na tayo magkunwari. Totoong nangyayari siya. At napakalaki ng tinatalon niya araw-araw.
Meanwhile, National Vaccine Experts Panel echoes the same sentiment as Omicron variant is present in the country.
Nakita po natin sa ibang bansa na matapos makapagpabakuna ang mga elderly, mga comorbidities at ang lahat pa ng iba ay ang nagkaroon ng COVID ay yung mga bata, no? Siyempre nagkaroon din yung iba na hindi vaccinated na adults, pero yung mga bata, kasi yun po talaga ang sinisik, ang tayang masabi nila, no? Ang virus, ang talagang pupuntahan yan ay yung walang proteksyon. Sino ang walang proteksyon? Yung hindi po bakunado.
5 to 11-year-old kids are expected to receive Pfizer COVID-19 vaccines as it was the only vaccine approved with emergency use authorization by the Food and Drug Administration as of today. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
Prime Minister Scott Morrison says that the days of lockdown are gone. Mavian Dog will tell us why live. Yes, Maeve?
Kath, Mr. Morrison said the new Omicron variant cannot be managed with lockdowns and that the focus should be on the health system. According to the Australian Prime Minister, the virus we are dealing with now is very different and that talking about case numbers is not the point. Mr. Morrison said the issue now is managing the impact of the current situation in hospitals. He is in talks with state premiers to ensure that there are sensible rules that will allow healthcare staff to go back to work. While the number of hospitalizations related to COVID had been increasing, Mr. Morrison said there were people included in the count even when they initially went to the hospital for other reasons. In order to deal with staff shortage, the government last week updated the definition of a close contact, which allowed healthcare workers back into hospitals. Close contact is now defined as a household or household-like contact who are living or has spent more than 4 hours with a confirmed case. At the latest count, Australia has acquired more than 32,000 cases in the last 24 hours. The active cases are currently sitting at an estimate of 188,597. Kath?
Thank you, Mavian Dog, reporting live from Australia. As fires have bursted in the U.S. state Colorado, 2 have been reported missing, while the U.S. president has named the event as a national disaster. Marvy Finn will tell us the details live. Marvy?
Currently, no fatalities have been reported, and according to Sheriff Joe Pell of Boulder County, a formerly missing man has now been found. However, 2 people remain missing in the state of Colorado as the fires sweep through the 2 towns, Superior and Louisville.
The Sheriff's Office currently has 3 missing persons, or as of yesterday had 3 missing persons reported. One of those persons has been accounted for alive and well, so that gentleman is no longer missing. We are still missing a woman from the town of Superior and a man from out by Marshall. The search for those folks is still underway.
The fires began very late into the year, igniting on Thursday last week in the northern outskirts of Denver. And within 2 hours of the fire starting, over 6,000 acres were burned. From there, strong winds with speeds of 160 kilometers per hour drove the fire east, where the towns Superior and Louisville reside. Over 1,000 homes have been destroyed, and more than tens of thousands of people have been evacuated and displaced. The Federal Emergency Management Agency stated
stated on the 1st of January that U.S. President Joe Biden had declared the event as a major national disaster, additionally announcing that help was available for those impacted. Victims of the flames can apply for grants for residential assistance, like temporary housing and home repairs, as well as loans for property losses. These are offered by the federal funding, which has been made available to the Boulder County. Meanwhile, officials are still unsure of how the fire began. Kath?
Thank you, Marvido Finn, for that report live from Australia. Sudan Prime Minister Abdallah Hamdok, who have just reinstated his power weeks ago, has now announced his resignation. Ruth Bahay tells us why live. Ruth?
Kath, Sudanese Prime Minister Abdallah Hamdok steps down to make way for sons and daughters of Sudan to lead their noble nation and help it pass through what's left of the transitional period to a civilian democratic country. Mass protests filled several parts of Sudanese capital in October when the military seized power and put the then Prime Minister Hamdok under house arrest. Mr. Hamdok reinstated his power in November after a power-sharing deal with the army has been agreed on. But the protesters are demanding an entirely civilian political rule. Hamdok's resignation led to another day of protests where medics said at least 2 were killed on Sunday. The former prime minister said he had tried his best to stop the country from sliding towards disaster.
ولقد حاولت بقدر استطاعتي أن أجنب بلادنا خطر الانزلاق نحو الكارثة والآن تمر بلادنا بمنعطف خطير قد يهدد بقائها كليا.
A news correspondent in Nairobi relieved that Prime Minister Hamdok's resignation is a big blow to the military leaders. Meanwhile, U.S. Secretary of State Anthony Blinken criticized Sudan's Independence Day held in January 1 due to violent attacks of Sudan security services against the pro-democracy protesters. Kath?
Thank you, Ruth Bahay, reporting live from Vietnam. January 6 marks the first-year anniversary of the mutiny at the U.S. Capitol, where supporters of former U.S. President Donald Trump illegally entered the building to stop lawmakers from certifying the results of the 2020 presidential election. With this, the Washington Post and the University of Maryland, or UMD, conducted a survey among 1,100 people between December 17 and 19 via phone or online, wherein 34% of the respondents say that violence against the government is sometimes justified. Through this poll, 60% felt that Trump shoulders a good amount of responsibility for his role during the attacks. 54% believe those who entered the Capitol were mostly violent. 19% see them as mostly peaceful, and 27% viewed them as equally peaceful and violent. 700 people from the insurgents have been charged by the Justice Department with offenses such as illegally entering the Capitol and assaulting officers, as well as members of the media, which also led to the deaths of several people. And those are the reasons behind the news in other parts of the globe. I'm Kat Tumaraos, live from Bangkok, Thailand. Good evening. And before we close, we will leave you with a word, giving glory to God. From the book of Proverbs, chapter 18, verse 15, it says, "The heart of the prudent getteth knowledge, and the ear of the wise seeketh knowledge." And those are the reasons behind the news, January 3, 2022. Reasons we deliver to you as they unfold. I am Herlene Delgado.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.